Hi, everyone. I'm Dr. Krista Burris, and I'm here with Dr. Michael Kim from Coachella Valley Direct Primary Care. And today we're going to talk about our state of the coronavirus in the Coachella Valley, as well as talk about a little bit of the new strains and the current vaccine situation in the United States and around the world. So I wanted to start with this first graph, and honestly, this is a good news graph. And if you look at the red line there, that's our hospitalizations, and you'll see that indeed we have continued the trend that we saw for the last couple of weeks downward. Our new hospitalizations are falling. This is really good news because this is the group of people that drives our deaths. And so as we see our hospitalizations fall, our death numbers will also fall. However, we're still seeing a high number of deaths, and we still have a long way to go as far as the absolute number of patients who are still in the hospital, as well as in the ICU. Those ICU numbers will also continue to drop, but they will drop at a slower rate. And the reason for that is because the significant length of time that it takes a very sick COVID patient to recover, it means that they may be in the ICU for several weeks and some for even longer. So because of that, our ICU numbers will be a bit laggy. Okay, so the next slide is our daily epidemiology update. And you'll see here on the left that our new cases by PCR reported out only 793. This is significantly lower than we've seen even on the last few days. And I suspect it represents actually an anomaly rather than a real sustained drop to this level at this point. If you go down and see our probable cases, which are those rapid antigen tests, those are still up around 12,000. So I suspect that tomorrow we'll see those new PCR cases be up in the several thousand range again. That I think just today was kind of just a reporting fluke, which we see frequently because the labs do report their numbers out in batches. So sometimes they'll report like 3 or 4 days on one day, and the next day will be fairly low. Okay, so going down to the bottom of this slide, we'll see that our that yellow line there is our percent positivity rate. And that's how many of the tests that are being done are coming back positive. And this is also still trending downward. Really like to see this, because what this means is that as long as we're doing enough testing, if this number is continuing to fall, that means the transmission rate in the community is going down. And that's also key. That's key for us to get out of the purple tier. It's key for us to get out of the pandemic. It's basically lowering the transmission rate is the key for us to open up again. So also moving in the right place. And you'll see that our testing numbers are still reasonably high. And so that's also good news. So let's go to the next slide. This next slide is our district report for District 4 in Riverside County, which represents the last week for the Coachella Valley. And you'll see here that our cases again are overall falling. We only had around 2,000 cases last week identified, which is significantly better. Also, our total cases are continuing to climb and our total deaths are continuing to climb. We will still, unfortunately, have a few more weeks of fairly high death numbers as we come out of the surge. And so our deaths from last week were 28, which is unfortunately high. And then let's go all the way to the bottom of this slide as well. So our local hospitals are continuing to um, see fewer patients. Unfortunately, they've also had a lot of deaths, which has lowered their ICU numbers. But they're also able to get their patients better, get them home, and not admit as many, which is also reflective of that lower community transmission rate. And our positivity rate currently is 15.2, which is mirroring the counties. We seem to be about the same as them. So kind of to segue into the next part of the talk, I wanted to show you this slide on vaccines. And one of the reasons I chose this slide is it kind of puts a lot of the vaccines up here for us to look at together so we can kind of talk about them a bit. So we basically can leave this slide up sort of as a reference of which vaccines are out there. And if you look at that first bar, that's Pfizer and BioNTech. That's the Pfizer vaccine. The next bar down is Moderna. The next bar down is something called the Sputnik 5. That is a Russian vaccine that's not available in the United States. So it's merely there sort of for interest. Novavax, the next bar down, that is in phase 3 trials. And you haven't heard about it in the media as much currently because it's not quite ready to apply for an EUA, but it's getting close. So that one, keep your ears open because you're going to start hearing about the Novavax as well. This next bar down is the Oxford or AstraZeneca vaccine. And that was the one that was halted for a while and has now restarted and has been being used in Britain already. So we'll have some information about that before it's approved here in the United States. The bar after that is Johnson & Johnson. That's the one that's been talked about recently, getting very close to applying for approval. That's the one that's only one shot and can be stored in the fridge instead of the freezer. And then the one under that is Sinovac. That one is a Chinese vaccine that, again, would most likely never be available in the United States. So these are the vaccines that we're looking at right now. So Dr. Kim, did you have any questions you want to talk about some of the vaccine issues that we've been discussing?
Yeah, so I guess the big question out there is if you've gotten your first or second vaccine, what do you do? So let's assume that you've gotten your first vaccine and you're waiting to get your second vaccine. What if you can't get it? What happens, Dr. Burris?
So one of the things that is a little bit of an unknown is what happens if you delay that second shot or maybe miss it altogether. And there are people who are saying it's fine, it'll still be 50% effective, that's good enough, let's just give everybody one shot and try to get them their second shot later. Then there are the people who say, actually, we don't know what's going to happen if we delay that second shot for a prolonged period of time. And I'm sort of in that second category. We know that if we give the shots as they were studied, we know what's going to happen with that. If we give the shots in a different way, we don't actually know what the effect on the vaccine strength will be or longevity. Like if we delay that second shot by a few more weeks, will we have the same immune response? It's unlikely that delaying a shot would cause any negative outcome to the person in the sense that they're not going to have more side effects or something. But the vaccine just might not be as effective if you give that second shot too far out. But we don't know. There's also significant chunk of people that do not have any protective antibody after the first vaccine. And it's not until they get that second shot that they have any protection at all. So there is that portion of the population who's not going to be protected at all the first time around, and we really do need them to get that second shot. So I'm really more in the camp of try to get that second shot done, within a week or two of the due date. I don't think it has to be done on the day. I don't think it's really that, rigid, but it shouldn't, we shouldn't have it be 3 months out because we don't know what the effect of that will be. That's my thought.
Yeah, no, I'm thinking without any data, this is just shooting from the hip. Probably a month out would be good enough. Not that I'm advocating that, but if it happens, then you might not get the 95%. You might be close to the 90%, maybe 89, which is still tremendous. So, but it was the question of, well, because I'm in the same boat. My second shot is due on Monday, coming Monday. So in 5 days. So, I don't know where I'm going to get it from. So I'm in the same boat as everyone. Um, what about after you get your first shot or even your second shot? What can you do? What can't you do? Can you do everything? Can you not do anything? What are your thoughts?
Well, I think that you still have to remember that we think that vaccinated people could develop mild infections and spread the disease. So until we have actually achieved herd immunity, where we have 70, 80% of our population immune, if you do get sick and spread it, you could be contributing to, that the ongoing pandemic. And so getting the vaccine, I think, is a really important thing that we're doing for each other, but we're not able yet to stop the masking and social distancing. I think that remembering that your personal risk of getting sick has gone down, but the threat you pose to other people still remains. So I think if people think of it that way of my personal risk has gone down, but it's not zero, and I still could be a threat to somebody I love, and then behave that way. So I may be less stressed about going in to care for my COVID patients, but I'm still going to wear all my PPE. I'm not just going in there, oh, I've been vaccinated, so I don't even have to wear a mask anymore. It's like, no, I could still catch a mild case from them and give it to my child or to an elderly patient. So keeping that in mind, behave accordingly. That's my
What about
thoughts.
people who have been vaccinated? Let's say my mom gets vaccinated and I'm vaccinated. Can we gather? Can we not? Do we follow the same rules that you just said? What are your thoughts?
What it looks like is for most of the vaccines, around um, 2 weeks after the second shot, people have pretty good immunity. But 4 weeks after that second shot, they have even better immunity. So it looks like if you're waiting a bit after your second shot, not like the day after you got your first shot, and you gather with a group of people who've all been vaccinated, I think in that setting, you actually pose very little risk to each other. But again, that's still an opportunity for a mild case to be transmitted and for someone in that group to carry it out of the group back home. So just keeping in mind that there's always that risk of that low level illness that you can transmit to somebody who's not immune yet. Um, the other thing is we know from other vaccines that the elderly don't respond as well to vaccination. Their immune systems are just not as robust. And so, knowing that even if they're fully vaccinated, they may still have a higher risk to contract COVID or severe COVID. Um, so, as we're vaccinating millions and millions of people over 80, we'll start to kind of get an idea of how much risk they still have. But I think until then, I would probably be okay with meeting with in a group with some other people who were vaccinated, as long as people still wore masks and kind of like took a bit of a precaution still. We're not quite out of it yet. We should
Yeah,
not give up masks, I don't think, until the level of transmission in the population is no longer at pandemic level.
no, I agree with you. And the other thing is that there's going to be people who get the both vaccines and, like you said, never develop a response. I was one of those with the hepatitis B series. It's a 3-shot series, and I had to get it twice. So just because you're getting the vaccine, you really don't know if you have antibodies or not. We're assuming you're going to get it, but there's going to be a percentage of people that don't. And so they're going to be just like everyone else. And if we assume that they're protected and they're not, that could be a problem.
Right.
So where can people get the vaccine in Riverside County? What have you heard, Dr. Burris?
Well, right now it's sort of a hodgepodge, and we've sort of experienced this as we've looked for a second shot for you. There are a few select independent doctors who have vaccine, but they have very limited supply and they primarily have it for their own patients. So it's not really worth calling around the private doctors at this point. Um, Larger health systems have started vaccinating beyond their staff at this point. They're now working through their patient lists. Each of them have plans that they've put out to their patients. They're trying to, like Eisenhower, the Desert Health Network, they're all trying to put out a plan to their patients. So if you're a part of one of these larger networks or even DAP, I would recommend going to their websites. And if you haven't already heard how they're going to do it, these tend to be like you wait for them to contact you. So it's not like I call and make an appointment. It's more like I wait my turn and they contact me and then I can make my shot appointment. And then, of course, there's the infamous Riverside County um, Hunger Games website of death that we all tried to use, some with more or less success. And it really is like Mad Max Beyond Thunderdome out there right now. And everybody's sort of struggling to try to get a shot. The problem in my mind is that we went from this very narrow plan where we were moving through these tiers in a very structured way, and all of a sudden, in like one day, they blew it up and said, okay, now everyone's 65 and older, and oh, by the way, all these other people, and they didn't have enough vaccine for that. So all of a sudden, you had the elderly who they had just started vaccinating, people in their 90s competing with people who are 65 on a website where what matters is how fast you can type. So this they sort of backpedaled, and last week all their clinics were just for 85 and over, which actually I think was a good idea because they really needed to get those highest risk people vaccinated quickly. And in the system they had now, they had essentially excluded them from the process. So they gave them a chance to kind of get in there. Um, and so, hi, Jose. The answer to your question is it depends on how fast the vaccines come in. Right now, they're constantly increasing the amount they're vaccinating. So we are seeing expanded vaccination every week, which is good. But currently, we have everyone who's already had a shot still needs their second shot. So in order to really increase the pace of vaccination, we need to more than double the amount of vaccination that we're doing. And instead, we're increasing by like 5% a week or 13%, or, so I think that basically, given the optimistic hope is that we'll be vaccinating the general public, which would mean all ages, whoever wants one, not until probably mid to late summer, would be my guess. What about you, Mike? What's your forecast?
No, I agree. Unless the production amount gets significantly increased, we're always going to be limited by the fact that you have to give second shots as well as first shots, and so they can't just give it to everyone unless the Johnson and Johnson vaccine comes out, and then that opens up a new algorithm. So
Yeah, I think the Johnson and Johnson is potentially the game changer because it could be easily mass distributed to small clinics because it can be stored in a fridge for 6 months, doesn't need a freezer. I think this is going to be the key, and because it's one dose, it's going to be the key to getting the regular public vaccinated quickly. And my hope is that one gets approved this month in February and gets rolled out very quickly, and that may speed things up. I think
right.
that could easily save us a month or two.
So in terms of the other question, the way that clinics have to apply for the vaccine is you have to register for one site, which is the site that the California state, um, where we report everyone we give the vaccine to or what happens to the vaccine. Then there's another site we have to register for, and that's the actual site where you actually get the vaccine. And then Riverside County, because we're in Riverside County, has to approve us as one of the sites. So right now, Riverside County has frozen the clinics. So our application is in, but it's frozen like many other. Only a few independent clinics got the vaccines the first round, and as well as the large institutions got them. So that's where the vaccine stands. And there are websites and numbers if you go to on the Riverside County Public Health COVID-19 vaccine, where you can call if you have questions, because it really does change, like Dr. Burris said, week to week. So, the best bet is to check the website, multiple times a week. And some of the pharmacies have it sparingly. That should ramp up soon, because supposedly the pharmacy is going to get direct shipment from the federal government, but we'll see if that comes to fruition or not.
Yes, and that's Ralph's and Albertsons. Have you heard any other pharmacies that are
I think Walgreens is gearing up.
okay? How about Rite Aid? I haven't heard anything about them.
Haven't heard anything about Rite Aid.
Okay. So, as we hear things, we'll update you regarding pharmacies, because that's probably also going to be a really important resource to getting it to the general public. A lot of people don't have primary care doctors, or at some point the county clinics might be less operational. So we'll see.
Right. Yeah. And we do want to let everyone know we're still testing. We can do PCR, which is a 2 to 3 day test. It is the best test out there. We can do the rapid 15-minute antigen test, because even though the numbers are coming down, it's still at a high level. We're still almost as high or higher than we were, before our current bump. And so just today we've had a couple positives that we tested at our clinic. So be careful out there, and if you need testing, definitely give us a call, or you can go to rapidlytest.com. That's our mobile testing site if you want us to come out to you. And just be careful. I'm a little worried about the new variants out there because they may cause another spike.
Yes, and we were talking a lot about how, we opened up again as a state a bit, even though we're all still in the purple tier. We're no longer technically under the lockdown. And just driving around, I'm seeing a lot more people out, like outside eating at restaurants, kind of packed together on patios. The Super Bowl's coming up. They've started to identify the variants, not just the British one, but also the South African and Brazilian variants in more places in the US. And we're kind of in a race against these new variants. They do pose a significant risk, probably the only significant risk for us right now for another surge is these variants, because overall vaccinations are going up. We have pretty good mask adherence. People's behavior are still a variable, but if these variants get going, then we could see another surge before we hit that herd immunity. And I'd rather have us come down to a nice low level and just kind of simmer along until we get to herd immunity later this year, rather than have another surge in the summer. Like, I think that would be just awful. So that's my hope.
Do you have any other questions, Dr. Burris?
So, we talked a little bit about what does it mean, if I get my vaccine, what can I do? I think another question that people have is, are these new variants, do they require different sort of social distancing? Like, all we've heard is they're more transmissible, but what does that mean? And how can we alter our behavior to protect against the new variants that may be coming our way here? Like, instead of 6 feet, should we look for more feet than that, if possible? Should we double mask? Should we wear face shields now? Like, what alternative things can we do to sort of stave off that potential summer surge? So
No, I would say, the data is early, but if it really is more contagious, I think the Swiss cheese model of the more things you can get between yourself and the virus, the more layers you put in, whether that's vaccine, whether that's 10 feet instead of 6 feet, or 2 masks versus one, I think will cut down your risk of when you get it, not if you'll get it. Because again, I've always been a proponent of we're all going to get it. I just want to get it when I have a good vaccine in me and the herd immunity is there, and so I'm not going to hurt anyone by spreading it. And I'm good because I have antibodies. That's when I want to get it, not when all
or
these
when you
measures
want to
are
be
still
exposed to it,
right.
because I've had a measles shot and I've never had measles. So it is possible that if we can get vaccinated first when we are exposed to COVID, we actually won't get it. So that's the point.
Well, I guess what I mean we'll get the SARS-CoV-2 virus, but we won't get COVID-19 itself, the syndrome
Yeah.
or the so.
Right. Well, I'm thinking a lot about the Swiss cheese model as well, because I see a lot of people kind of moving towards doing the least possible that they can. If they have to throw on a bandana, they'll do that instead of a mask, or maybe they'll wear face shields instead of a mask. And right now might not be the time to be doing the least amount, you can get away with. I even have sort of upped my mask game. I've been changing out my masks more frequently, washing them more frequently if they're cloth, sometimes doubling up. Um, some studies have shown that people who wear glasses actually catch it at a lower rate. So having some sort of eye protection, if you have glasses or sunglasses and you're going to be in a room full of people, probably better to wear them. Um,
Oh, there's a
if
Swiss cheese.
Hey, yeah, Swiss cheese. So every layer you can put, like you said, um, if you're if you're sitting at a table, sit, instead of sitting right across from each other, sit staggered a bit and pull your chairs back a foot. And just that little bit of movement, will actually separate you by 2 or 3 more feet. So anything that you can do just to get into the habit of sort of thinking that way and making it sort of natural to kind of put that little extra space there. Again, this is not human nature for a lot of us. This is going against our instincts. Normally, we are very social. We like to be close. We like to talk. We like to laugh. Um, and so it is difficult, but it does help. It does work.
Oh, that's all I got.
Well, I think that's probably enough. and for everyone out there, I just want to say happy Valentine's Day coming up. Um, be safe and use this year to be creative about your Valentine's Day plans. You can still support our local restaurants and businesses and maybe make a little plan to do something fun and romantic out in nature rather than crowding into a smaller space with lots of other people. But I do really want to people to support our local businesses and also stay safe.
I agree with you. I think supporting local businesses is key to the pandemic as much as wearing social distancing, masks, and all that. You can do takeout, you can eat outdoors. There are certain industries that are still open. I got my hair from Therapy Salon. Thank you, Therapy Salon with Eileen Tenbrook. They run they follow all the protocols. And so it was something I was willing to increase my risk because I was not looking good. So I think if we all continue doing what we're supposed to do and support the local businesses, I think we things will improve.
Yeah, this year still seems, even with all the unknowns, by the end of this year, we really should be much closer to our pre-pandemic functioning. So keep your eyes on the prize. What we're trying to do is get through this with the least amount of death and tragedy. And that includes the mental health toll it takes as well as the financial tolls taking on families. And so we do want to, put it out there that, pay attention to your mental health. This is definitely a marathon and we all need support. And so sometimes getting some human contact is actually worth the risk. I just want people to do it thoughtfully and judiciously and in as safe a manner as possible. All right, I think that's it for today. And thank you again, Swing Point Media. And we have also been putting this on our YouTube channel as well as our Facebook page, and hope to see you all next week, where hopefully we continue to have some good news.
Bye, everybody.